Hi there, and welcome to the Stethoscopes to Swaddles podcast. This week on the podcast, we are on week 3 of the 5-week series titled Trimester 1, 2, 3, 4, 5, Pregnancy and Beyond, You Can Survive. So, what is the third trimester? The third trimester begins in week 28 of pregnancy and lasts until you deliver, which may be around week 40 of pregnancy. The goal of this episode is that after listening to this episode, you will know what to expect in the third trimester and how to prepare for the arrival of your baby. A quick note is that some mamas do not experience this trimester, and these are NICU mamas. This episode is not just for first-time moms. It may also benefit moms who have previously had NICU babies who did not experience a full third trimester. So I just wanted to be sensitive to that. And if you're listening to this and this sounds like new information because you were a NICU mommy, first of all, I want to applaud you for successfully bringing those teeny tiny humans into the world. And I want you to have the information you need if this is a subsequent pregnancy after a NICU baby. Hi there, I'm Shira Bergbauer, and I'm passionate about supporting working moms. I'm a life coach, wife, mom, and nurse anesthetist. On this podcast, I teach you the tried and true secrets to achieving work-motherhood balance. Parenting, relationships, health, self-care, and personal growth are all topics we discuss on this podcast. Nothing is off limits. Think of this as your one-stop show for happy hour with a mama friend mixed with life school. Pull up a seat, get cozy, and get ready to be empowered while you learn. Welcome to the Stethoscopes to Swaddles podcast. So what is happening in the body in the third trimester? One of the first things is abdominal achiness. As the baby is growing and expanding and using up more room in the abdominal cavity, this may cause you to have some aches and discomfort. It may be harder to get comfortable when you're in bed trying to sleep, and it may even feel like it's harder to take deeper breaths just because of the compression of the abdominal organs on the diaphragm and baby pushing up against everything. Now remember, the abdominal cavity hasn't really changed. There's just had to accommodate for the presence of a baby in there. The left lateral position, that is lying on your left side to tilt the abdominal cavity and organs and the baby away from the larger vessels of the abdomen. It's still recommended, even though I know in previous years the studies have shown no great benefit to doing that, but it's honestly, I feel like a very comfortable position. It kind of shifts everything away from the back, and you can lie on your side. The pregnancy pillows are such an asset in this trimester, although it's literally like rocket science just learning how to use them. I actually remember one of my friends sent me a video of her husband recorded her when she was pregnant, like how to position the pillow, and I still couldn't figure it out. It took me a little bit. But the beauty of that pregnancy pillow is that now my toddler daughter uses it as a cocoon in her crib, because she's like, oh, I can just kind of feel cozied up, and so it's still handy 3 years later, so it's worth the investment. So going back again about the abdominal pressure, back pain because of the extra weight that you've gained and pressure on your back from the abdominal contents. It may feel some discomfort in your back and also in your pelvis and your hips, because remember, your ligaments are preparing for labor. So one of the things to remember and be cognizant of in this trimester is practicing good posture, sitting up straight, and using a chair that gives you back support. If you need extra lumbar support, it's important to kind of invest in something that this could help with, just to have the pressure off of your back. Another thing is sleeping again with a pillow, just kind of making sure you're comfortable. And then wearing comfortable shoes with good arch support. So as your ligaments start to stretch, some people will experience that their feet are changing in size, and this is part of it is just because of the stretching ligaments. Remember, the hormones are kind of causing everything to kind of stretch and prepare the body for labor. If you haven't had any pelvic floor PT, this is a good time to kind of get acquainted with pelvic floor PT. One of the things I realized in my own pregnancy was that my pelvic position was kind of tilting, and so I would have to get like readjusted and make sure my pelvis was straight. And so that was one of the benefits of PT, because I would go for my pelvic floor, obviously, but then I would also get physical therapy for just making sure my pelvis was aligned. One of the other things in this trimester that was so uncomfortable is my pubic symphysis. I guess with just the ligaments and everything stretching around, I would wake up at night to go to the bathroom, and like that little shift in the middle of the night, oh my goodness, it was so uncomfortable. And so PT was really, really good. They did this thing called the shotgun maneuver, and I can't even describe it, but it would just like be instant relief. It was amazing. So if you haven't had pelvic floor physical therapy, highly, highly recommend it. Bleeding, some light bleeding towards the end of the pregnancy may be a sign that labor is starting, but also be cognizant, because spotting may be a sign of a serious problem, including placenta previa. And placenta previa means that the placenta is growing low and it starts to cover the cervix. And then it could also be placenta abruption, which means that this placenta starts to separate from the uterine wall, or preterm labor. So it's highly important that you call your doctor as soon as you notice any bleeding, because you don't want to just like blow it off. And it's better to be safe than sorry, especially in this time. You may start to feel Braxton Hicks contractions. These are just like your body like warming up for actual labor. They're not as intense as real labor contractions, but they may feel a lot like labor and can eventually progress to it. One of the main differences is that real contractions do get closer and closer, and then they get more intense. So one of the things that like my doctor's office would say is like, if you're getting red in the face and you're out of breath after your contractions, or they're coming regularly, then it's time to call your doctor and just know the next step forward. I will say, I feel like contractions were such a weird, like, I don't know. It almost feels like you have to experience them to be able to like know like what's like a normal contraction versus Braxton Hicks. The other thing is that the breasts are enlarging and they may start leaking. And the interesting thing is that your breast could grow by as much as 2 pounds. So make sure you're wearing a supportive bra that really helps your back kind of stay in that posture. You just want to make sure that you're like really, really getting support, because then you start kind of crouching, and then you have low back pain, you have thoracic spine pain. So just be cognizant of your posturing and your breast support. As you get closer to the due date, you may notice like colostrum leaking. One of the things about colostrum is like some people will try to like collect it. Just be aware that if you start trying to actually stimulate breast milk production, you can actually activate labor. So be aware of that. Vivid dreams are common, and also nightmares, and this can be very disruptive to your sleep and also unsettling. Again, those crazy hormones, that's what causes it. The hormones levels are changing, and so this may cause wild dreams. You may start to feel clumsier in the third trimester and also out of balance. You may also start feeling like carpal tunnel type symptoms, like just numbness in your fingertips sometimes, just like weird achiness. One of the ways I noticed, for me, I didn't develop carpal tunnel, but what I know is that in my practice, we usually place arterial catheters once our patients are under anesthesia, and that requires you to be able to palpate the radial pulse. And one of the things I noticed was that I just didn't have the feel, like I couldn't feel it as much as I did before I was pregnant. And because you start kind of losing a little bit of that proprioception. So funny thing how I was like flustered with myself one day. I was trying to place a line. I was just getting really frustrated. And I was like, something's wrong with me. I can't place a line. And